Hi, welcome to SkyLynn Mind Body Health. I'm your host, Ilynn. Today's topic will be looking at ankle therapy. This will be good for anything that is a minor ankle sprain, grade 1 ankle sprains usually, or someone that has had maybe a severe ankle sprain but they have now progressed to do any types of exercises because they have more full range of motion and strengthen their ankle to do so. So just a couple exercises that are pretty basic across the board. We want to work on range of motion, and we want to work on strength. And then we want to work on balance or the proprioception. So if you're at home, you sprain your ankle, I'm going to show you exactly what to do when you're doing at-home ankle therapy. Range of motion is usually done first. Someone starting out, we just start with ankle pumps. So the 2-minute timer, where they do 30 reps. We do circles, full range of motion at the ankle joint. And last but not least, ABCs. So all I'm doing is I'm imagining there's a pencil in between my big toe and my second toe, and I'm tracing A, B, C, D, E, F, G, and I will go all the way through letter Z. I usually have my athletes do uppercase as well as lowercase. Same thing, lowercase a, lowercase b, lowercase c, lowercase d, all the way through letter Z. Depending on the time that I may have with them, they may do 3 reps of uppercase and 3 reps of lowercase. So that's range of motion, and we want to work on strength. So give you some options. We have tubing here, which is one option you can use. We have the flat bands, and we also have flat TheraBands. So if you go to the store, you're probably either going to see one of the other tubing or flat band. So if I went to the store, I'd probably find something like this. And they are different colors. So you have green, blue, red, yellow. So depending on the intensity and the resistance, it will depend on the color you get. So I have a moderate resistance band right here for green. And if you're at home by yourself, you can still do these. So I just have a simple knot to make a loop, and I have a knot right here that I can hold on to. When you sit down, make sure your leg is straight, your knee is stabilized, and your ankle has free range of motion. So this first exercise we will do is a plantar flexion exercise. You're going to put resistance on the band, and all you do is go forward like you're hitting the gas pedal. I tell my athletes that I have that come in, start off with 30 reps, or in some cases set the timer on their cell phone to 2 minutes. So they just want to try and attempt to go full range of motion on plantar flexion, 30 reps. Once they get 30, we're going to go into E version, or putting the ankle to the outside. So as you can see, the only thing moving is my foot at the ankle joint. A common mistake in technique that may be done is if their ankle is really tight and restricted, they want to move the knee. See? Watch, let me try that one more time. They want to move the knee, and so the whole leg ends up moving. This is incorrect. Keep the leg still. That's correct. Same thing, 30 reps, or set the timer for 2 minutes. Next, we'll go into inversion. Same thing, knee stays nice and secure. The only thing moving is the ankle. "30 reps, or set the timer for 2 minutes. The last exercise we will do with the TheraBand will be dorsiflexion. So I can either rest my foot on the table itself, or use my shin for support. All I'm doing is I'm using the band for resistance up top, and I'm flexing my foot towards me, which is engaging this muscle right up in here. Tibialis anterior muscle, which you can see right in here. Watch when I flex. This tendon pulls all the way up to this muscle right here. And this main muscle helps dorsiflex my foot. Okay. We covered strength. Now we'll go into balance. Our balance technique, if you're at home, nervous system's connected to telling our body what to do. So we want to make sure that is also staying fine-tuned and in key with what we're doing and sensing where our joint is in relation to where our body is. So the whole thing about balance is making sure you're stressing that component. So usually start off at 30 seconds, trying to hold for 30 seconds, balancing. Work up to a minute, maybe 2 minutes. Now granted, if you have sprained your ankle, this may be really challenging. You might be wobbling, putting your foot down, moving side to side. As you get stronger, you're engaging that nervous system more. And then for added difficulty, if you're at home and you have a pillow or an uneven surface, you can put the other foot down, balance again, start off at 30 seconds, do that for 3 times. Once you get 30 seconds down pretty well, start a timer for a minute, hold it for a minute, and for fun, if you have someone at home that has a tennis ball, toss the tennis ball. See how well you can hold that balance while you're tossing the tennis ball 30 times. So you're engaging your nervous system, your skeletal system, and your muscular system all at once. So that covers at-home, very basic therapy for ankle joint. Also, let's not forget we got to stretch these muscles out. So we want to make sure we stretch our calves. You have 2 big muscles in the calf. You have a gastrocnemius muscle and you have a soleus muscle. Gastrocnemius muscle, that's the muscle you see when you see someone do a calf. It's very pronounced, it comes out. We want to stretch that. We're going to go into a wide stance, almost a lunge. Make sure this back heel stays on the ground, leg is straight. And all I'm trying to do is stretch this calf muscle as best as I can while I lean my body forward. If the heel comes up, that's incorrect. We want to keep the heel down. Now stretch the soleus, which is a deeper muscle. You can't really see it underneath these bigger muscles. You're going to put a slight bend in the knee. The more you bend that knee, the more soleus stretch you're going to get out of that. Same concept, your heel stays on the ground. You're going to lean your body forward as far as it will go. And you're going to hold. Bring it back a little bit. Now each stretch you want to hold for approximately 30 seconds and up to a minute. I usually have my athletes do 30 seconds 3 times of the soleus, 30 seconds 3 times of the gastrocnemius stretch. All right, and that will cover your ankle therapy exercises for at-home therapy. Thank you for watching. Like, subscribe, and leave comments.